Live లో ఉన్నప్పుడు yeah, she has to be camera should be. Good afternoon, ma'am. Hello, ma'am. Ma'am, I'm audible to you, ma'am. Hello, hello. Ma'am, I can't able to hear you, ma'am. Ma'am, I'm audible to you, ma'am. No, ma'am. But you are not audible to me, ma'am. I think you are on mute, ma'am. No, no, no. Hi everyone. We'll start our meeting in a couple of minutes.
Now, am I audible?
Yes, mom, you are audible now.
Great. Okay. Yeah, shall we start? Already, I think we are late.
Yes, ma'am. Good afternoon, everyone. Welcome to today's webinar organized by Ankura Hospital for Women and Children. I'm Sailata. I'll be hosting this session. Today, we'll be discussing delayed speech in children, when to worry and when to act, an important topic for every parent where early action can truly shape a child's future. It's my pleasure to introduce our doctor, Dr. P. Keerthi Kundana, consultant pediatric neurologist who will be guiding us her expertise and insights. Over to you, Doctor.
Hello everyone. Thank you for giving me this opportunity to interact with everyone. I have deliberately chosen not to show any slides because then the discussion becomes very one-sided, and I would like this discussion to be a two-way so that people can interact and even interrupt me in between and ask questions.
You can mute. Mom, no, I can't able to hear you, mom. You can join through phone only, mom. It's better.
Yeah, so I'll continue here only. So when we talk about speech, speech is when we talk about speech.
Mom.
This is him.
Ah.
Yeah. So when we talk about speech, speech is a very higher intellectual function. It's only human beings who can talk, right? Animals do not have that privilege to talk, and to somewhat they can understand. But this talking speech is a blessing, you can say, to the human beings. So it is a higher mental function. We have evolved over the centuries to develop this function of speech, right? And there is a very common misconception that children start talking only after the age of 1 year, when they say mama, papa, and all these things. But actually, speech develops very early. Right from the time when the baby is born, the baby is trying to speak in some or the other way. Though it's not meaningful to us, but for the baby is trying to express itself. The earliest language milestone that the baby has is at around 3 months of age, when the baby starts cooing. Like the baby makes sounds like ooh, 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 ah. So all these words, which is called as cooing, the baby is trying to communicate something. And by the time the baby reaches maybe 6 months, monosyllables start. For example, da, anga, unga, oo, these type of words start. And by the time baby reaches 10 months, we call something as bisyllables, like mama, dada, papa. These types start. And by 1 year of age, meaningful words, at least one meaningful word, the baby starts speaking. It could be as simple as mama. When I say meaningful, the baby should be looking at mother, addressing the mother as mama. It's not like randomly the baby is saying mama, mama, mama. That's not a meaningful word. The baby is projecting towards the mother and purposefully calling mama. Then we call it as a meaningful word. So we say that babies develop at least one meaningful word by 1 year of age. And the maximum time that we can wait till babies at least have one meaningful word is 1.5 years. So if babies don't develop at least one meaningful word by 1.5 years of age, it is a red flag. And it needs to be evaluated. That means we say that there is some speech delay. So the words are not coming on time, right? So why am I telling all this? This is the normal speech development in a child. Now I am talking about expressive speech. Now there is something also called as receptive speech. Speech has two components, receptive and expressive. By receptive, I mean how I am understanding the speech. So receptive language also develops very early, as early as 6 months. Like a 6-month baby can respond to the name being called. The baby identifies that it's his or her name that is being called, and the response by either looking in the direction of whoever is calling. So that's an receptive, that the baby is understanding what you're talking. Okay, so that kind of response, that response to the name call, comes as early as 6 months of age. And by 1 to 1.5 years of age, babies are able to obey simple commands. For example, give the toy to me, go there, put the bottle there, give this to mama, give this to papa. So obeying simple commands, these are one-step commands. Like we are saying just one step. There are not multiple steps there. Just one step. Go there, come here, give this, get this. So these are one-step commands. So between 1 to 1.5 years of age,
Mom, your voice is breaking. Sorry for interrupting.
Children are able to, maybe then I'll repeat this, that if by 1.5 years of age, babies are not able to obey simple commands, one-step commands, then also it's a red flag. That if there is a problem in the receptive language of that child, and that needs to be evaluated, right? So I've told you 2 important red flags, that no meaningful word by 1.5 years of age. These 2 things, and not responding to name call by 1.5 years of age. So these are the 3 common flags which parents should see if the child is developing well or not in the domain of speech or not, right? That, as I said, like receptive and expressive language, now both of these are interrelated. If there is a problem with reception, there will definitely be a problem with expression. All right. Now how do we understand the speech? What is the basic mechanism? The basic mechanism is that whenever I hear a word, it reaches my ears. Through the ears, there is a connection to the brain. So it travels to the brain, gets processed in the brain, and then comes back through the mouth. So it is a circuit which is established level in the circuit. There can be a problem with speech. So reception happens at the level of ears, conduction from ear to brain. So there occurs conduction. Processing happens in the brain. The brain decides, okay, what type of sound is this? From where it is coming? How do I derive the meaning of this sound? Is it a meaningful language or not to me? So the brain will try to decode whatever the information has come to the brain. And then the brain will direct the expressive part of the brain. So in our brain, there are 2 areas. There's a receptive part of the brain, which analyzes the received language. It sends signals to the expressive part of our brain, which tells the mouth to produce words. So there are different areas of the brain which are working together. So speech is a very complex process, and there are many levels at which all these networks are continuing. All right. So why am I saying this? So if there is a problem with reception, for example, like if there is a hearing issue, the child cannot hear properly. If in case, then also you'll have, if rest of everything is fine, brain is fine, our oral mechanism is all fine, brain is fine, but the sound is not reaching the brain itself because of any hearing problem, it will result in language delay and speech delay. So the first thing whenever we come across any child who's not talking on time is we check for hearing. Is the child able to hear or not properly? That's a very, very important examination to be done, because many children do not get diagnosed with hearing impairment till around 1.5 to 2 years of age also. And the hearing impairment comes to notice only after 2 years of age, when they are not able to talk. And the child does show early signs that he's not able to hear. And what signs do these children show? For example, they'll try to use sign language. They'll try to do lip reading. They're very intelligent. So they try to do lip reading. They try to communicate through sign language. They try to observe your actions rather than words to understand you. So these are some of the clues when we suspect any hearing loss in children. So that is the first and foremost thing which should be suspected if a child is talking late, whether hearing is good or not. Right? So if hearing has been evaluated and if it is fine, then we look at the brain, how the brain is functioning. And how do we know how the brain is functioning? It's not just through some fancy tests or anything. It's just by assessing how other milestones. For example, did the child walk on time? Is the child behaving appropriately, like his or her age? Is the child understanding well? Is the child also learning properly? Is it only speech which is affected, or other domains of development are also affected? So this is how we get to know overall clinically how the functioning of the brain is. And sometimes, if brain is also fine, but there may be a problem with the jaw, the teeth, the tongue, and there can be sometimes some deformities are there. For example, cleft lip, cleft palate, okay, tongue ties. There can be some retrognathia, that is small jaw or something. So if this apparatus, this oral apparatus is not formed properly, then also the speech might not come clearly. Okay, so this is at all these levels we evaluate a child, whenever that at what level the problem could be, and then how do we treat it. Okay, but as parents, it's important to identify that okay, there can be a speech problem or not. For that reason, we need to know the normal milestones, the normal speech milestones. And if anything you feel like there is no meaningful word by 1.5 year of age, child is not obeying commands by 1.5 year of age, and sometimes these can be crossed. For example, the child reaches 2 years of age, the child obeys the commands but is not having enough vocabulary. So by 2.5 year of age, child has a vocabulary of 250 words. So a 2.5 year old child knows the meaning of around 250 words. Okay, so if that much of vocabulary is still not developed, then also it's a delay and needs to be evaluated. Okay, so these are the red flags I've talked about at what levels the problems can be and how do we evaluate. And so to talk about the causes, I told you about the hearing loss. Then I told you about any middle ear. So there can be a problem with either the middle ear, that is the ear is not developed properly, or there can be a problem with the conduction, that is from the ear to the brain, the pathway is not formed properly or is damaged because of any reasons. So the most common reason in India due to which this hearing loss can happen is something called as kernicterus. By kernicterus, I mean whenever babies have very, very high jaundice. By jaundice, I mean very high. When your bilirubin is more than 20, 25, that much high it goes in the newborn period, then this very high bilirubin can damage the hearing nerves. So it's very important to get proper and appropriate treatment for the newborn jaundice, because not the routine jaundice. The routine ones do not cause usual problem, which are usually treated with phototherapy. But the very high ones, where you need to sometimes do exchange of the blood and very high doses of phototherapy are required. So very high jaundice is a risk factor to develop any hearing damage in the newborn period. So that is one risk factor. If any perinatal asphyxia, by that I mean that if the baby doesn't cry properly at birth, and because of that there is any deficiency in oxygen reaching to the brain, and the brain has to suffer the damage because of less oxygen supply for some time. So that can even cause problems with hearing. So any type of hypoxic damage at the time of birth where the oxygen couldn't reach the brain in time. So these babies do not usually cry at birth. So not crying at birth is a risk factor. Okay, and sometimes any meningitis in the newborn period. By meningitis, I mean any infection of the brain or the brain coverings in the newborn time. So because the nerves are very, very tender at this age, and any infection of the coverings during this age can even damage those hearing nerves. So that is also a risk factor. Any meningitis, that is infection of the brain or its coverings in the newborn period. So these are the risk factors that these children can develop any hearing impairment. Sometimes there are some congenital anomalies of the ear. For example, the ear canal is not formed properly. The ear pinna is not formed properly. The connection between, in ear, we have three parts: inner ear, middle ear, and external ear. If the connections between these three is not formed properly. So any anomalies of the ear development. Okay. And second, I told you about how the nerve damage, any hearing nerve damage that happens. Third, if there is any genetic problem. So there are some syndromes which are associated with hearing impairment. So some genes which control the hearing signals. So if there are certain genetic causes of hearing impairment, so even those things can cause it. All right, so genetic causes. Now, the other thing that can happen is if there is any associated intellectual delay. By intellectual delay, I mean that those children who have lower IQ, for example, by IQ, I mean general understanding, general adaptation, general learning. For example, a 2-year-old child can eat with his own hands. A 2-year-old child can see, copy, and bathe himself. A 2-year-old child indicates his needs, like I want this, I want that, I don't want this, I don't want that, I want to wear that dress, I don't want to wear this, I want to go to washroom. So all this is general understanding. We call it as socio-adaptive skills. Okay. So if these skills are also lacking, if the child is not able to adapt socio-adaptive behavior, if it is less, if learning behavior from the environment is less, we say there is a low IQ. Low IQ can also cause speech delay. Okay, so because other skills are affected, similarly, speech could also get affected. Right. So, and that low IQ, then again, there are a number of causes. It could be related to the brain and its brain formation and its functioning. For example, sometimes the brain formation is not correct. The brain is not formed properly. There are the size of the brain is not adequate. It's either less or more. We have a number of folds in the brain. So those folds are not formed properly. The small brain, we say, we have a big brain, cerebrum, and we have a small brain, cerebellum, if that is not formed properly. So any structural malformation of the brain can cause both your intellectual delay as well as speech problems. Right? Then similarly, here also genetic problems. Any genetic problem that affects the functioning of the brain can cause this. Some of these chromosomal problems like Down syndrome, Turner syndrome, And all these chromosomal problems, these are also genetic problems, can also cause speech delay. Right? And so this was all about what all causes could be there. And if all these things are fine, the brain structure is fine, the hearing is fine, everything is fine, still the child is not talking, there could be two things. Either it is isolated speech delay. That means everything is fine, but only talking is not there. Okay, we call it as isolated speech delay. Usually they improve with age. By 5 to 6 years of age, usually they improve, but sometimes some children can have problems. And second thing comes is autism spectrum disorder. So autism is also a known cause for a speech delay, and usually autism gets identified because the child is not talking. But when I say autism, it is not just speech delay. Along with speech, there are also other problems, mainly in the social milestones. And there are also some repetitive behaviors. So when these three things combine, that is socialization problems, language problems, as well as repetitive behaviors, these three together when present becomes autism spectrum disorder. It is not just isolated speech problems. So that's why whenever, as a doctor, as a pediatric neurologist, any parent comes to me and says the child is not talking, so these are all the things which are going on in my mind, that where the problem could be and what risk factors this child had. Are the other milestones developing fine? How are his social milestones? How are his behaviors? All these things we assess, and then we form a plan that how much should we evaluate this child and how to treat this child. Okay. Now to talk more about autism, just to say a few words about it, like how to identify what are the early signs of autism. The earliest sign could be something like the child is not responding to the name call by 1.5 year of age. Even on calling 10 times or 20 times, the child will respond only 2 or 3 times. Okay, so that is one of the feature. Second thing, they have repetitive behaviors. For example, lining up of the objects, like they'll keep their toys one after the other in a line. So lining up of the toys. Third, there could be something like hand stimming, like, hand flapping like this. They'll keep on doing this repeatedly whenever they feel anxious, whenever they feel happy or sad, in any kind of emotion, they'll try to show it using their hand flapping like this. There could be other features like poor eye contact, that even when you're trying to talk to the child looks here and there but doesn't look into your eyes directly while communicating. And other features, they could be something like not able to obey the simple commands, that even we're trying to tell him something, the child doesn't obey them. And when we say, okay, you give this, you keep this there, they won't be able to follow. So these are some of the features, if present, then needs evaluation for autism spectrum disorders. Okay. Now, after having talked about all this, then we evaluate children that into which category, whether it is a hearing problem, whether it is a problem with the intellectual delay, whether it is autism, or whether it is an isolated speech delay. So we try to categorize children in these 4 categories, and then we form a plan. Okay, what might help this child? But my message to all the parents would be, first, to improve the speech development in children, it's very important that the child gets exposed to the words. The child will not speak unless he hears the words. So in nuclear families where both the parents are working and the child mostly either stays in is taken care by nanny or someone, and so the child should be exposed to minimum 1,000 to 2,000 words per day. Unless the child hears human sounds, human voices, the child will not develop speech. It's very simple. So that's why we say whenever you're interacting with a newborn baby, make face expressions, talk to the child. It is not that they are not just looking at you. They are observing you, they are looking at your facial expressions, they are looking at what you're trying to say, they are looking at your body language. They are taking, and their brain is getting used to what this human creature and how this speech comes and all. So speech stimulation begins right from newborn stage. That's why we say all the parents, talk to your baby, talk to your baby. It's not that babies are dumb. They are processing, their brains are processing immense information from the environment that they're getting. So it's very important that we keep talking to the babies, and not just in young period, even when they grow old, that children should be in an environment where they are hearing a number of words daily. It's not important that I'm talking to the child directly. Even if two people are talking to each other and the child can overhear it, that is also a form of stimulation to the baby's brain. Okay, so that's why I would avoid as much screen time as possible. So through screen, what happens? The child gets used to a one-way communication, because the screen doesn't talk back. The child talks, even if the child says something, the screen doesn't talk back. So he gets used to that one-way communication. Communication should always be two ways. If someone is talking to me, I answer him back. All right. So the child should be in an environment where two-way communication is encouraged. If a child asks for something, if a child makes some sounds, makes some gestures, as an adult, we should reflect it. Okay, you're trying to say something. Okay, oh, that's what you want. So it's always important that you reflect. Whenever a child is making any gestures, it's important you reflect. That is how the speech develops. Okay, so that is the reason where we say less than 2 years of age, zero screen time, no screen time at all. And the third way of stimulating speech in children is to sing. Parents are the more the mothers, and not just mothers, even fathers or whoever the caretaker is, grandparents, whoever the caretaker is, the more they sing. Okay, the babies capture the rhythm better than a plain word. That's why we say rhymes and all that. They have a simple rhythm, simple tune, because they catch it better than a plain monotonous word. So the more you sing, the better is it for the child's brain language development. And fourth suggestion would be, whatever your activity you are doing, put a word to that activity. For example, even if I am feeding the child, I'll tell that, okay, I am feeding child to, if the child's name is Rohan, something. Okay, Rohan is eating his food. Mama is giving Rohan food. So describing your activity, it's simple activity like bathing. Okay, now one mug Mama has put on Rohan. Now Rohan is taking bath. So just attaching words to the activity that you are doing. That is also a form of stimulating the brain, and the child is learning, okay, so this activity is called by these words. Very stimulatory for the child's brain development. Okay. So that's it from me. It's all about whatever I had to share about how speech develops, how speech problems, what type of speech problems children have, what are the causes, and what are the simple things that we can do at home to improve speech in children.
Any questions? Can you please message in a chat box? Any questions, please? Meanwhile, ma'am, I have few questions. What is considered normal speech development for a child at different ages?
Sorry.
I'll type in a chat box, ma'am, so that you can see. chat box you can open now. What is considered normal speech development for a child at different ages?
Yeah. So there is a very nice, this I wanted to show actually. There's a very nice chart that has been developed by Child Development Center, Medical College, Thiruvananthapuram. This chart is actually used by many doctors, even research workers, healthcare workers, and even at Anganwadis it can be used whenever we are suspecting any child delay. So I'll show you. I have it here. How do I wait? Yeah. So I'm showing. Can you see? I don't know if you can
No,
see.
madam.
It's not clear, right?
No, ma'am.
I'll just tell the name.
Okay.
This is called as TDSC, Trivandrum Development Screening Chart. TDSC. You can put it on Google. You will easily get it. So TDSC, Trivandrum Development Screening Chart. It comes in two charts, 0 to 3 years, 3 to 6 years. And it tells you the exact age, at what age a child should have in terms of language. So it is up to 6 years of age. So you can compare. If you have a doubt, you can compare from this chart. Okay, is the child following it properly or not? And there is also something called as LEST, okay, language assessment. So LEST, so that chart also you can use. So these are two charts which even a normal parent also who's with basic education also can understand. It is for the community purpose only. LEST chart is for language, and Trivandrum Development Screening Chart, TDSC, is for the overall development. So these things parents can also use it, and it's freely available on the net.
Okay. Mom, one more question. Can bilingual or multilingual homes causes?
Yeah, this is a very common question.
Yeah, same asked by Anirudh.
Yeah. Yes. So it's a very common question that is asked. It's not directly related, actually. It is not like bilingual language will cause speech delay. It is not directly related. In fact, those children who are exposed to multiple languages at early time are known to develop all those languages together. For example, a 2-year or 3-year-old child who's exposed to three languages, that is, they speak one language at home, they speak one language at school, they are able to speak three languages by 5 to 6 years of age. So it is not, I wouldn't say that it has, speech delay has to do anything with the bilingual or multilingual. In fact, it is good. But what is important is, whenever I'm talking, I use one language. That is more important, and not to mix the languages. That is more important. If you're able to take care of that, and if I'm giving an instruction to a child, I'm talking to a child, use only one language. Don't mix one word from this language, one word from that language. Of course, that will cause confusion. But I wouldn't say that bilingual. In fact, it is good for the brain that we are getting exposed to those languages, but directly not related.
Mom, through YouTube, we got one more question.
Yeah.
Screens are reasons for kids that they are not speaking?
Yes, screens, yes, definitely. As I already told in my discussion, that through screen, you get used to a one-way communication style. And the brain starts forgetting that we have to communicate in a bi-directional way. That if someone is asking a question to me, I have to respond it back. Because screen doesn't want that, right? Screen doesn't demand you responding back. Screen will show you content, but screen doesn't ask you to respond back. And that's what the child gets used to. That even if you're talking to me, I don't have to respond you back. So that's why screens, definitely, yes, they have a major role in affecting the speech development. And second thing, also, whenever, even if we are exposing to the screen to young children, we should make it try to be interactive. It should not be some boring cartoon on the TV or some Cocomelon which is playing on the TV and the child is just staring at it. if I have to give screen time, see, I understand, I'm also a working mom. I have to give the screen to the child sometimes because they don't listen. But I try to make sure that the whatever is happening on the screen, the child is trying to interact. For example, I'll give you the example of my own child. So there was this A for apple, B for ball coming. Okay. So earlier what she used to do, she would just stare at it. But now she has started repeating. Like A for apple, if the screen says, she will also say, okay, apple. If the child is at least trying to interact back, okay, that is okay, you have made some use of the screen. So always try to make the screen interactive. That is, otherwise, no, it's of no use.
Mom, final question. Can hearing problem cause speech delay?
Yes, hearing. Yeah, definitely. Yes. It's a known risk factor. Yeah, and because it's treatable. Hearing problems are treatable. So in fact, there is recommendation from Indian Academy of Pediatrics that all newborn babies should be screened for hearing at birth itself. It's called as a universal newborn hearing screening program, and all the newborn babies, because otherwise we miss that early period of language development if we miss it. So yeah.
We got one more question from Anirudh. Role of speech therapy.
Yes, there is a role of speech therapy. As a doctor, my job is to prognosticate first, depending on the cause, that how much chance is there for this child to develop speech if I give speech therapy. If I feel that the prognosis is very good, that okay, this child, if I feel, depending on the risk factors, depending on the cause, depending on the evaluations, I feel that yes, this child will develop speech if given proper speech therapy, I will definitely recommend. There are certain, so those we tell from before, okay, the prognosis is poor. So as a doctor, it's my job to prognosticate who can develop and for whom there are good chances and for whom there are less chances. So we prognosticate, and depending on that, we advise speech therapy. And yes, speech therapy helps. It helps.
Any questions, please? Okay, ma'am. Thank you.
Okay.
Thank you so much for your insights. Thank you, everyone.
Yes. Thank you. Thank you.